This is Monique Griffin. She's from Orlando, Florida. And we're going to start with diaphragmatic breathing. The importance of diaphragmatic breathing is to provide energy to the body, bringing oxygen to the cells, which produce energy. You can consider it a fuel pump. So if we look at Monique's breath pattern, she tends to breathe into her upper chest, and she's using a lot of her neck muscles. And we want her to use her diaphragm more, which will literally pull the air down into her lungs. So if with her hands here, I can direct her to breathe, try to take a breath in through her nose and draw the air down into her belly. So on the inhale and exhale. And I'm going to just press her hands a little bit to show her the abdominal muscles helping to get the air out of the lungs, and the diaphragm drawing in. And if you can exhale through your mouth, Monique, that would be great. Inhale through the nose. Exhale. Inhale. Exhale. Breathe into my hands. And the lungs really need to inflate three-dimensionally, because if we only expand into the front, we're going to be distorting our alignment, going into excessive extension. Whereas you think of taking it into the sides and the back of the lungs, it's really going to be helping to support the spine. So we can also work on lateral chest expansion, where Monique will take a breath in and direct it towards her rib cage. Sort of like a bellows. Inhale through the nose. Inhale. And she seems to do better taking the air to the lateral sides of her rib cage. Slowly in. Exhale. Another technique that can be helpful with someone who's got restricted expansion in their lungs is to take sniffs, inhaling consecutively, sort of like thinking of blowing up a balloon and you're trying to get just a little more air into it, and you but it's going to be so thinking of taking that air to the left, and you can see she gets a little more expansion. I'm thinking of using the abdominals to press the air out. We are also seeing the place she prefers to inhale, direct her air to, but there we go. Let me take my hand away so they can see that a little better. Okay. And I'm just using a technique to put a little pre-stretch on that muscle, which will help her to expand her lungs laterally.